Okay, let's be real. Navigating the world of fertility treatments can feel, well, pretty overwhelming. You're probably hearing these two acronyms all the time, IUI and IVF. Now, they both can lead to parenthood, but trust me, they are worlds apart. So we're going to dive in and decode exactly what these options mean for you. I mean, are you feeling totally lost in this sea of acronyms? IUI, IVF, what does it all mean? Yeah, you are definitely not alone, and that's exactly what we're here to do. We're going to cut right through the confusion, give you a super clear side-by-side comparison, and hopefully make you feel a lot more empowered on your journey. All right, here's our game plan. We're going to cover two paths to parenthood, get into the nitty-gritty of IUI and IVF, talk numbers with success rates, and of course, compare the costs. Then we'll look at some of the advanced options IVF has to offer, all leading up to helping you make a really informed choice.
Okay, first up, two paths to parenthood. The best way to think about this is that IUI and IVF are just two very different routes to the same destination. One is a simpler, less traveled road, while the other is more like a high-tech superhighway.
All right, so let's get down to the basics. What actually happens during these procedures? Because this right here is where you'll see the biggest, most fundamental differences. Okay, if you remember just one thing, let it be this. The absolute core difference between IUI and IVF is where fertilization takes place. With IUI, we're helping it happen inside the body. With IVF, it's happening outside the body in a specialized lab. So let's zoom in on IUI. That stands for Intrauterine Insemination. And what it is essentially is a procedure where a specially prepared, concentrated sample of sperm is placed directly into the uterus, right around ovulation. The whole idea is to give the sperm a major head start, but after that, it's pretty much up to nature to do the rest. And the process itself is pretty straightforward. You've got three main steps. First, you're carefully monitoring ovulation to get the timing just right. Then, the sperm gets prepared in the lab to pick out the strongest swimmers. And finally, the insemination itself, which is a super quick procedure, honestly, a lot like a pap smear. Okay, now let's switch gears to IVF, or in vitro fertilization. This is a whole different ballgame. It's a much more involved process. We're talking about retrieving eggs directly from the ovaries, then fertilizing those eggs with sperm in a lab. That's the in vitro part, which literally means in glass. If that's successful, the resulting embryo is then transferred back into the uterus, where hopefully it'll implant and begin to grow. So yeah, the IVF process is definitely a journey. It starts with ovarian stimulation, usually involving hormone injections. Then there's a minor surgical procedure to retrieve the eggs. After that, it's off to the lab for fertilization, and the final step is the embryo transfer. You can see right away it's way more complex than IUI. Okay, so now we know what they are, but let's get to the question that's on everyone's mind, right? Do they actually work? How well? And this is where the numbers, well, they start to paint a very, very clear picture. All right, let's start with IUI success rates per cycle. For women who are under 35, you're looking at about a 10 to 15% chance of a live birth. But, and this is a big but, that number drops pretty steeply with age. For women over 40, it's down to just 1 to 5%. That's a huge difference. Now, let's compare that to IVF. For that same group of women under 35, using their own eggs, the success rate for a live birth per cycle jumps to around 50%. I mean, that's a massive leap. And while the rate does go down with age, it's starting from a much, much stronger position. Yeah, and this quote really just says it all, doesn't it? When you look at the raw data, IVF is clearly more effective across all age groups, especially for women over 35. It's a statistical reality. But wait, there's another really powerful number we need to talk about. For women who might be facing age-related fertility challenges, IVF using donor eggs can have a success rate of over 50% per transfer. Why? Because the success is tied to the age of the egg donor, which kind of bypasses the whole issue of the intended mother's age. It's a real game changer. Okay, so higher success rates. That usually comes with a higher price tag, right? So let's talk about the money. We're moving on to comparing the costs, which, let's be honest, is a huge factor for pretty much everyone. So IUI. It's often looked at as the more affordable first step into fertility treatment. You're looking at anywhere from $500 to maybe $2,000 per cycle. It feels a lot more accessible right out of the gate. And then there's IVF. And the contrast is,
Yeah, it's stark. A single IVF cycle can run you anywhere from $15,000 to over $26,000, especially when you factor in all the medications. It's a really significant financial commitment, no question.
But here's where we have to look beyond the sticker price, because the numbers can be a little deceiving. You have to think about this hidden equation. You see, doing multiple IUI cycles that don't work can end up costing you more, both financially and emotionally, than going straight to a single successful IVF cycle. It's this crucial trade-off between cost per attempt and overall effectiveness. Right, so beyond just the higher success rates, IVF unlocks a whole world of advanced medical technologies and family building options that you just can't get with IUI. So let's take a look at what those are. Okay, these are things that are exclusive to IVF. First, pre-implantation genetic testing, or PGT. This lets you check embryos for chromosomal issues before they're transferred. We already talked about how IVF is compatible with donor eggs. It's also absolutely essential for anyone using a gestational surrogate. And, of course, you get the option to freeze any extra embryos for the future. These are all incredibly powerful tools that give you so much more control. Okay, we have covered a lot. We've gone through the procedures, the success rates, the costs, and all those special capabilities. So now let's pull it all together and talk about how you can start to think about making a really informed choice for yourself. And here it is, the whole story in one handy table. You can see it all side by side. For IUI, fertilization is inside the body, success rates are lower, the cost is lower. But you don't get those options like genetic testing or surrogacy. Then you look at IVF. Fertilization in a lab, much higher success but also a higher cost, and it's the gateway to all those advanced options. Seriously, this chart is your ultimate cheat sheet. At the end of the day, the right path for you is going to depend on so many personal things. Your medical diagnosis, your age, your finances, your family building dreams. So we want to leave you with this question to think about. After seeing all of this laid out, what's the one question you still need an answer to so you can take your next step? And remember, the very best way to get that answer is by talking with a reproductive specialist.